Mayor and council members. I am Stephan Harvey, and I work at the California Center for Public Health Advocacy, which is a statewide organization addressing obesity and chronic disease from a public policy standpoint. I'm thrilled to be here this evening, listen to this debate, and I want to commend the council for considering very seriously the proposal that you're considering this evening. I've been aware, I've been in California working with the California Center for Public Health Advocacy for only a decade. I was well aware of the fact that your city has a vibrant health element. What I was not aware of until Dr. Bruner and I believe some of the former individuals mentioned the key leadership role that Richmond played all those years ago on the tobacco issue. Dr. Bruno mentioned that the soda industry, the three major soda companies and minor soda companies, spend millions advertising to our youth. A recent study that was put out by the Rudd Center at Yale University looked at how those marketing dollars were spent. And I just want to mention one finding from that study. Their analysis showed that African American youth here in Richmond, elsewhere in California, across the United States, African American youth see 90% more advertising for sodas than white children. So again, this evening, I would like to commend the City of Richmond, the Contra Costa County Health Department for the leadership that you're providing on this issue, and the California Center for Public Health Advocacy strongly supports your work. Thank you very much.
Thank you. Ms. Henry, I'd like to ask you a question. Ms. Henry, could you come back? I'd like to ask you a question.
I'd be happy to.
Sure.
And actually, just for the record, my name is Ms. Harvey. It's my handwriting.
Oh, okay.
I do apologize.
All right, Ms. Harvey. You stated that 90% of African Americans see more advertising for soda. How do you get that? Where do you get that standard from? Are you saying that they only advertise in the Black community?
No, I'm just saying, and this was a study put forth by the Rudd Center at Yale University, and I'd be happy to forward the details of their analysis to you tomorrow and to other council members. My understanding of the findings were that African American youth saw 90% more advertising for soda than Caucasian children.
So is there a study that African Americans drink more because of that?
We see consumption rates among African American and Latino children here in California at higher rates than consumption rates for white children. The California Center for Public Health Advocacy with the Center for Health Policy Research at UCLA looked at consumption rates of California youth and did find that consumption rates among children of color were higher than consumption rates among white children.
What were those numbers versus African American versus Hispanic?
I'm embarrassed to say I can't remember the numbers specifically. And again, I would be happy to forward them to you tomorrow.
Thank you.
You said 90% of African Americans are provided advertising more than the Caucasian. Is that what I heard you say?
Yes.
And in what form of advertising?
Again, I don't know the specifics of the study. I believe the analysis done by the center at Yale looked at all forms of marketing of soda, so that would include print ads, television ads. My guess is, but this is only a speculation on my part, ads on cell phones, internet ads, the whole breadth of advertising that the soda companies employ.
Well, I would question that because I don't know unless you're purchasing ads in predominantly African American newspapers and magazines. When you put an ad out, it's consumed by everybody, the Twitter, whatever you want to call it, Facebook. All of these advertisers is viewed by the multitude of people and not just African Americans. So I question that analysis. Thank you very much.
Okay, thank you. Clerk, are there any more public speakers? No, so that's the public speakers. Okay, thank you to